Hi everyone, my name is Elizabeth Chaddick, and my dream agency would be called Build Up Louisville. I actually went with Building Up first, but I kind of like Build Up Louisville a little bit more. Um, and basically, what we would do is focus on people experiencing houselessness and try to get them into stable housing so that they can also address some of those other needs that they may have going on. There are a lot of issues with that in Louisville, and there are some programs that already exist, but um, I would really like a specific culture around this program and kind of um, assist with the current programs that are already out there just because houselessness is such a big issue in Louisville. So um, the mission state would be to assist people of all backgrounds that are currently experiencing houselessness with stable housing, vocational services, and mental/physical health treatment to allow the individual to continue building up their lives. And the vision statement would be that every person has access to stable housing and healthcare despite any current barriers that they may be facing. And then the values would be respect, compassion, and dignity. I think that, sometimes in our efforts to help, we can maybe come off a little condescending at times, and you know, expect people to be grateful for things that they may not have asked for. So, um, just really kind of putting people on an equal playing field, um, and understanding that that could be any of us at any time, and kind of having that respect for people. So, and then my board would be about 10 to 15 people just because it is, a kind of hefty project. Um, so I would really start out with like those clinical social workers, psychiatrists, medical doctors, and like housing administration to kind of focus on like the main priorities there. Um, Also public health, anyone in nursing, peer support specialists. I really would love to have peer support specialists on the board. I think that would be a key part in trying to understand where people that are experiencing houselessness may be coming from that we may not understand if you haven't been in that position. So having someone that really does understand what it's like and has been through it, I think would be helpful. And then, um, someone for accounting, a lawyer, just because this would be a pretty big liability. There are several politicians right now in Louisville that are working towards trying to focus on houselessness and trying to get people off the streets and things like that. So I think that could also be a potential area to outreach and market. There are also some other programs, like I said earlier. We do have a Housing First initiative here. Change Today, Change Tomorrow does a lot of stuff with houselessness right now, especially with the recent snow and ice that we had. There were a lot of community leaders that were out there um, trying to help people. Um, and then, let's see. I would also, so the budget would be kind of pricey. It'd probably be around $37,000 just for 6 months, and it could easily be 50,000. In all honesty, just with the price alone of buying an apartment building to kind of start that up to do housing, and then the price of utilities and things like that to keep the place up and running. Um, that alone is pretty pricey. So we would have probably part-time staff. Salary would be about $10,000 for the first 6 months. So like really focusing on volunteer work as much as possible, considering how much this costs. We would have costs for a lawyer, insurance for sure. Um, would definitely want to have housing insurance. So, and then the job description for volunteers would be the agency is working towards providing stable housing for those that may be experiencing houselessness. Volunteers will need to understand compassion and be willing to work with vulnerable populations of all backgrounds. This volunteer position consists of community outreach, transportation of residents, organizing donations, creating living spaces for new residents. Volunteers will be expected to go through 2 weeks of training for working with any residents. Any background in houselessness, community outreach, or substance use is preferred. This position is unpaid. I did want to kind of make sure that substance use was in there. Um, the main priority with this nonprofit would be that people can come in regardless of whether whether they're working or currently using, which is different than a lot of the shelters here in Louisville. You really kind of have to be careful with that kind of stuff. A lot of places will not take you if you're under the influence of things like that. Again, for the liability reasons. But this nonprofit would focus on getting people into housing first, because you can't really focus on getting clean or working on your mental health conditions if you don't have housing, because that's going to be your first priority. So that's kind of where that comes from. And then some of the policies and things like that for volunteers would be going through a 2-week orientation, which would consist of ethics, diversity, and trauma-informed care. They would sign a waiver kind of acknowledging their expectations and requirements, follow the same rules and regulations as paid staff, arrive on time for their shifts, report to their volunteer coordinator for what they're supposed to be doing for the day, provide auto insurance and driver's license updates if they are going to be transporting residents. And then every 6 months, volunteers will receive like a performance review, just kind of like staff would. And then I also put in here that if there's any concerns about practices or ethics, an evaluation may be required earlier, and that the agency reserves the right to terminate volunteers at any point if they aren't in compliance with the rules and guidelines. So that is my dream nonprofit. So let me know what you think. I appreciate any feedback. Thanks.